We're moving on. Natalie has the next question, and it is to Team JLP.
Jamaicans seeking care at public hospitals continue to face long lines, shortage of medical staff, overcrowding with the difficulty getting a bed if admitted, and long waits for clinic appointments. What is it going to require to improve patient care at public hospitals and other healthcare facilities?
Let me say this. The government takes it very seriously in terms of improving the health infrastructure. We have upgraded 138 of our health centers. We have rebuilt and restructured key hospitals and are starting to construct the regional children and adolescent hospital. And most importantly, in addition to the health infrastructure development, we are and have created 3,000 positions for medical professionals with 1,000 community aids and 600 scholarships, which means not only better infrastructure for health, but better staffing of professionals who will be able to provide better service to the patients in Jamaica. We take this very seriously, and that is why under this government we have seen where not only the 138 health centers and the key hospitals, but the expansion of NHF, the expansion of the hours and services, all of these providing a comprehensive delivery of service for the people of Jamaica.
It's important to remember that the Jamaica Labour Party inherited a health sector in absolute crisis, where their own opposition spokesperson said that surgeons had to be wearing garbage bags to operate.
Thank you so much, Ms. Kamina Johnson-Smith. PNP, your 45-second rebuttal.
If there's any evidence of the Jamaica Labour Party's failure, it is evident in the health system. Indeed, Cornwall Regional is an excellent example, having moved from $2 billion all the way to $22 billion and still not complete. Mammograms in our public sector is only 2 mammograms in our public sector. And the #1 hospitals in Jamaica, also including our children's hospital, does not have an MRI or a CT scan available. Indeed, the number of children that has died neonatals has gone up to 246 over the last 2 years.
The better proof of it is the absence of the Minister of Health at a social issues debate where he should have answered to his appalling track record. He's now been there over the economic debate.
Thank you so much, Mr. Price. Thank you so much, Mr. Price.